I'm just going to talk about chronic pelvic pain. I'm Dr. Samar Gupta and I'm a junior consultant in gynecological cancers at the Hinduja Hospital. See, chronic pelvic pain is something which is an intermittent or a constant pain which a woman would experience in the lower abdomen or pelvis. And the way we define chronic pelvic pain is it should be at least of 6 months duration and not occurring exclusively with menstruation or intercourse and is not associated with pregnancy. It's not a diagnosis, it's just a symptom, it's something that you feel. Three issues about chronic pelvic pain. It's one, difficult to diagnose, difficult to treat, and very difficult to cure. It's very frustrating not only for the patient but also for the doctor, because sometimes we just feel that it's just not possible to treat the patient. Just a few facts. Just to allay anxieties, 15 to 20% of all women in the reproductive age group would suffer from chronic pelvic pain, which means that women between the ages of 15 to 45, almost 1 in 5 would have chronic pelvic pain. In fact, 20% of all the diagnostic laparoscopies, which means we need to put in a laparoscope inside the abdomen to see what's happening. Almost 20% of all the diagnostic laparoscopies that we do are done for this purpose. And almost 15% of all the hysterectomies, that is 15% of all the surgeries required to remove the uterus, are for chronic pelvic pain. So it's a fairly common phenomenon. And the reason why it's such a difficult thing to treat is because it's, there's more than one component to chronic pelvic pain. Obviously the physical component, maybe there is, maybe there's a small tumor on the uterus, or maybe there's an infection, or there's something which is a physical thing that we can find out. But there are a lot of psychosocial, emotional and social factors, that trigger chronic pelvic pain. For instance, in some women who have a lot of social issues at home, a lot of emotional strain, the brain interprets that strain in a different way, and the woman starts actually perceiving it as pain in her pelvis or pain in the abdomen, pain in the back. So this is known as a psychosocial aspect, and it's very important for all of us to recognize whether there's actually a physical component or an emotional component. Pain by definition is a sensory and emotional experience which is associated with actual or potential tissue damage. So not necessarily that there has to be some tissue damage, it could just be a perception of one's own, what one actually perceives. So this is just a chart that shows a lot of issues why there could be causes of pain. As far as the gynecological issues, these could be endometriosis, fibroids in the uterus, adenomyosis, which are perhaps the most common causes of pain. Pelvic pain can also be because of intestinal problems. A very common symptom that women suffer from is irritable bowel syndrome. So that can give rise to pain. And there's a whole load of list here, which could include cancers and so on and so forth. In fact, interstitial cystitis, now this is a term where women have a lot of pain in their bladder. Every time they pass urine there's pain. So there are a lot of causes of pain. Musculoskeletal problems, problems with the muscles, the bones. So all these can actually give rise to pain. So if you look at that earlier list, there are a large number of causes that have been given. But what are the most common things that we actually see in our practice? As far as women are concerned, endometriosis and adenomyosis, these are two conditions which are most common. Now endometriosis is a condition where actually the lining cells of the uterus come outside the uterus and go anywhere else in the abdomen. As a result of which, every time the woman has her periods in the month, these cells tend to bleed or tend to grow in size, and therefore there can be pain. So this is one of the causes of pain that we see very commonly. Endometriosis is a very common condition, and it's often associated with infertility and many other issues related to women. Adhesions, these are typically women where they've had some surgery done in the past, and now things get stuck inside, the intestines get stuck to these areas where surgery has been done, and this can also give rise to pain. Or sometimes the ovaries get trapped in tissue which is known as scar tissue, and this can give rise to pain. So there are a lot of causes of pain. As I mentioned earlier, irritable bowel syndrome, interstitial cystitis, these are typical conditions that happen with the lower intestines and the urinary bladder and can give rise to continuous pain. And as I said, psychosocial issues also. So what do we do when, say you come to us and you complain of chronic pelvic pain, or there's, you come to us and tell us there's always pain inside the pelvis, there's always pain inside the abdomen. Obviously we take a detailed history, we ask you a number of questions related to the pain, whether the pain is associated with periods, whether the pain is associated with your meals, whether the pain is associated when you pass urine or stools, and so on and so forth. The nature of the pain, does it actually get relieved with medication, does it not? So there are a large number of questions, and based on that, we get an idea whether we need a urologist to take a look at you, or somebody who's a specialist in the intestines and the stomach to take a look at you, or whether it's purely a psychological issue and you need somebody, a counselor, to look at you and talk to you. Obviously, a thorough clinical examination is done, so gives us more information on what is happening. And obviously, depending on what we find, we might ask for a number of investigations, which would include screening for infections, blood studies, and so on, maybe sonographies, MRIs, and if required, even a laparoscopy, an examination under anesthesia. Some of the things that we look out for, which we call red flag symptoms, which are obviously very dangerous symptoms, and we need to actually assess and treat very urgently, which would be something like bleeding that comes from the rectum, or once a woman has crossed 50 years of age, after that there are some new symptoms like pain while passing stools, or constipated for a very long length of time, things like that. These are new bowel symptoms that come after the age of 50 and are dangerous. Or if there's any pain in the lower abdomen after menopause, if there's a small lump in the abdomen, if there is an irregular bleeding after the age of 40. So these are some of the things that we call as red flag symptoms, and anybody displaying these symptoms or tells us that these are the problems, we always consider them very seriously and run a number of investigations. Treatment. Now, treatment obviously depends upon the specific disorder that we are looking at. As far as gynecological disorders are concerned, the commonest thing that we would see is fibroids in the uterus, as I said, or endometriosis or adenomyosis. So the treatment could start from anywhere from simple antispasmodics or simple pain relief medication to hormonal therapy. We also advocate lifestyle changes. Then at Hinduja here, we also have a pain specialist. So we refer you to a pain specialist. So it's a multifaceted treatment. And it's not that we always jump at surgery. Surgery may or may not be required, but it's something that we can always think of at a later stage. Yeah, the question that you've asked me is, what are the symptoms of chronic pelvic pain? Well, the symptoms of chronic pelvic pain basically are pain itself. But I'll just run you back to one of the slides that I showed earlier. So the moment we say chronic pelvic pain, it basically means any pain that one would experience in the lower abdomen or in the pelvis of at least 6 months duration. So it should be a pain that's there for the last 6 months, and it's not generally associated with periodic bleeding or with intercourse, or it's not even associated with pregnancy. It's just a pain that's there for the last 6 months. Now that's when we would define it as chronic pelvic pain. Right, the treatment for chronic pelvic pain, again I'll just take you back to one of the slides that I showed a little earlier. It again depends upon the cause of the pain. Now as I said, we would take a complete detailed history, ask you about the nature of the pain, the periodicity of the pain, the duration of the pain, whether it's associated with your meals, whether it's associated with vomiting, whether it's associated with periods or not, or whether it's, it comes in bouts or it's there continuously. So after asking a whole load of questions, in fact there's a very detailed questionnaire that we have, and we stick to that questionnaire. At the end of that, we get an idea whether you need to be seen by a urologist because the pain may be from the bladder, or you need to be seen by a gastroenterologist because it could be an intestinal origin pain, and so on and so forth. And then obviously you would run a number of investigations on you if required, and then we actually come down to the treatment schedule. And the treatment would actually be based on what we find after the history, the examinations. But if you're actually looking at gynecological issues, then yes, you can start off with simple painkillers. Yeah, it is a good option to take painkillers, but not every time, because if you have to take painkillers every time, then obviously we need to figure out why there's something wrong with you, or is there something that we are missing, and then try and treat it more specifically. And as I was saying earlier, for gynecological problems, then obviously painkillers followed by hormonal treatment. So there are a number of options even in hormonal treatments. So we can always go to them step by step and then get to the bottom of what the real issue is. Yeah, pregnant women, that's a good question. Do pregnant women get chronic pelvic pain? Pregnant women do get pain, but then we do not actually call it chronic pelvic pain, because chronic pelvic pain is something that is not associated with pregnancy. Pregnancy by and large is going to bring about relaxation of the pelvic muscles, the pelvic ligaments, and therefore they're going to get some amount of pain, which is generally going to increase throughout pregnancy till the end. But once the baby is born, most of this pain disappears. and therefore don't really term it as chronic pelvic pain. We term it as pain that's associated with pregnancy. But yes, you're right, pregnant women can get chronic pelvic pain. If someone has been actually operated upon the intestines, then usually what happens is, the moment a surgery has been done, in course of time, the intestines and other tissues inside tend to stick together, and that's called adhesions. Now, because these tissues stick together and cause adhesions, they can stick to each other, they can stick to the bladder, they can stick to the uterus. These kind of things can happen, and this can actually give rise to chronic pelvic pain. So let me paraphrase what you've written separately. If you've had an operation in the intestines, then the risk of you getting chronic pelvic pain is much higher. But who is going to actually get that chronic pelvic pain? It's a very difficult thing to define. Men can get, yeah, you're right, men can get chronic pelvic pain. The causes are slightly more different. Just a second. So if you look at this chart again that I've shown here, men can definitely get chronic pelvic pain. The only issue is that the gynecological, the number one cause would be out of the picture, but yes, the gastrointestinal causes, the urinary, the musculoskeletal, the systemic causes, the rest of them can all give rise to chronic pelvic pain. Men can get a lot of chronic pelvic pain because of intestinal issues, can get because of the bladder, can get because of the prostate gland, and of course the musculoskeletal. So yes, men can get chronic pelvic pain. That's true. That again is a good question, Jack. The issue is women are more susceptible to chronic pelvic pain. Men, of course, get chronic pelvic pain. If you look at the statistics that I've actually shown right in the beginning here, right? See, the statistically proven 15 to 20% of all women in the reproductive age group get chronic pelvic pain. The chances of men actually getting chronic pelvic pain is much less. It would be less than 7 or 8%. So the reason for that, we don't know. The next question from Gami is it a good option to take painkillers every time? If you have pain, obviously you go ahead and take painkillers. But if you have to take painkillers very regularly for pain, then one needs to, as I said, find out why there is that pain. Because then there are specific ways in which you can treat those, the reason for which the pain is there. So yes, you should take painkillers, but you need to find out the reason why. Because taking excess of painkillers over a period of time doesn't really solve your problem. It's going to, the main reason why the pain is there is still going to remain. And obviously painkillers over a period of time can have certain bad effects on your kidneys and liver and so on and so forth. For men, what are the chances of having chronic pelvic pain? As I said, about 5 to 7% of all men would suffer from chronic pelvic pain at some point of time. But usually it's very self-limiting and it can be treated with medication. It's much less than what women experience. Thanks, Jack. Thanks, Gami.